Warning! Watch this video or you will regret it. Cancer is a disease that many people fear, but for the elderly, that fear is many times greater. Because the immune system is weakened, mutated cells are more likely to develop, and unfortunately, many initial symptoms are easily confused with common old age diseases. Therefore, many cases are only detected when cancer is in the late stages, at which point all interventions are difficult and ineffective. However, cancer does not come as a surprise if we know how to listen to our bodies. There are signs that are small, but are early warnings from the body, especially in the elderly. In this video, we will review 5 signs that seem trivial, but can be indicators of cancer in the elderly. Do not ignore any of these signs, because they may be an opportunity to detect the disease in time and save lives. Unexplained weight loss. In old age, mild weight loss due to poor diet is normal. But if a person suddenly loses 3 to 5 kilograms in a few months without dieting or exercising, it is a sign that needs to be very alert. Unexplained weight loss is one of the most common signs of cancers such as lung, pancreatic, liver, stomach, or intestinal cancer. Why does cancer cause weight loss? Cancer cells consume energy very quickly. They can change the body's metabolism, causing muscle and fat loss. Some cancers also secrete substances that cause loss of appetite or nausea, bloating. Elderly people already eat less, have weak muscles, so when they lose weight due to cancer, the condition will worsen faster than in young people. Never be subjective about natural weight loss in the elderly. Take them for a general examination, blood test, or abdominal ultrasound to find the cause. Persistent cough or persistent hoarseness. A cough caused by a cold usually lasts only a few days to a week. But if the cough persists for 3 weeks or more, especially if it is accompanied by bloody phlegm, at night accompanied by hoarseness, difficulty breathing, it could be a sign of lung cancer, laryngeal cancer, or serious damage to the bronchi. Older people often have sore throats and colds, so the cough symptom is easily overlooked. But the difference is, cough caused by cancer does not improve even after taking medicine. Hoarseness accompanied by fatigue, chest pain, weight loss. Long-term hoarseness is also a sign that needs to be checked immediately because the vocal cords can be damaged by tumors in the throat or esophagus. If your elderly relative has a persistent cough or persistent voice changes, take the initiative to have them have a respiratory endoscopy or chest X-ray soon. Early detection of lung cancer triples survival rates. Prolonged digestive disorders. Some digestive changes, such as bloating, indigestion, constipation, irregular diarrhea, or changes in bowel habits can be an early warning of colorectal cancer, stomach cancer, pancreatic cancer, especially if accompanied by signs such as bloody stools, even very little. Long-term loose stools of unknown cause, dull abdominal pain, bloating after eating for many days, loss of appetite, feeling full after eating little. Because in old age, digestive function is poor, these symptoms are easily considered as common colitis or digestive disorders due to eating. However, the difference lies in the fact that the symptoms are persistent, recurring, and increasingly severe. Gastrointestinal cancer is one of the most common cancers and is difficult to detect early. Therefore, regular gastrointestinal endoscopy is highly recommended for people over 60 years old, especially when there is any unusual digestive disorder lasting more than 2 weeks. Lumps under the skin or swollen lymph nodes. A small, palpable lump under the skin, even if it is painless, is a red flag that something is wrong with the body. In older people, some lumps are benign, but if they grow quickly, are firm, do not move when touched, and do not disappear after a few weeks, it could be an early sign of cancer. Breast cancer in both men and women. Lymphoma, skin cancer, soft tissue cancer, In addition, persistent swelling of lymph nodes in the neck, armpit, or groin is also a sign that needs to be checked. Even if it is not painful, if the lymph nodes gradually enlarge and feel hard to the touch, it could be related to lymphoma or metastasis from elsewhere. Older people should not be subjective with small lumps. Get checked to know their nature. Ultrasound, cell puncture, or biopsy can help determine whether they are benign or malignant. Unexplained persistent fatigue. We often think that it is normal for the elderly to be tired, but if your loved one feels exhausted for a long time, no longer able to do the things they used to do not take it lightly. Prolonged fatigue is one of the earliest signs of many types of cancer, especially leukemia, liver cancer, lung cancer, bone marrow cancer. The reason is because cancer cells consume the body's energy, disrupt the blood-forming process, causing anemia and rapid exhaustion. Signs to watch out for: tired even though you get enough sleep, easily dizzy, lightheaded, frequent yawning, unable to concentrate, night sweats, rapid heartbeat. Unexplained fatigue in the elderly should be tested for blood and screened for cancer regularly. Don't wait until they are bedridden to take them to the doctor. By then, the opportunity to intervene has passed. Slow healing sores or unusual changes in the skin. In older people, the skin becomes thinner, drier, and more sensitive. Small injuries such as scratches, sores, or unusual moles are often overlooked. However, if these signs persist without healing, they may be early signs of skin cancer, a silent but very dangerous disease in the elderly. Pay special attention if you have the following symptoms: sores that do not heal after more than 2 weeks, especially in areas often exposed to sunlight, such as the face, ears, hands, and feet. Moles that change shape, color, have blurred edges, grow quickly, or bleed. Thick, red, scaly, or rough patches of skin that can be mistaken for dermatitis but do not heal with medication. Many older people subjectively think that slow-healing wounds are due to aging skin, but it is this subjectivity that gives skin cancer the opportunity to develop silently and spread. In particular, melanoma, although rare, is the most dangerous type because it can quickly metastasize to other organs. Don't ignore small injuries. If an ulcer or mole shows unusual signs that last longer than 10 to 14 days, take your loved one for an early checkup. Timely detection can make treatment simple and avoid serious complications. Cancer is not a death sentence if detected early. Unfortunately, many elderly people miss the golden opportunity because they ignore the early signs. Unexplained weight loss, persistent cough, prolonged hoarseness, abnormal digestive disorders, tumors, swollen lymph nodes, unexplained fatigue. These 5 signs, if they appear in the elderly, need to be checked as soon as possible. Just one examination can save a life. Please share this video with your relatives and the elderly around you. Maybe thanks to you, someone will detect the disease in time. And don't forget to like and share the video if you find the information useful. Subscribe to the channel to watch the next videos on the health of the elderly. Thank you for watching. Wish you and your family good health.